Hello, I'm Dr. Sydney Lefay, a consultation liaison psychiatrist. Today we are going to talk about one of the hottest topics in psychiatric practice, the therapeutic use of psychedelic compounds. The recent flood of interest in psychedelics can be overwhelming, and many times some fundamental questions can get lost in the shuffle. What are psychedelics doing for people, and how do they even work? What does the research on psychedelic compounds mean for the future of psychopharmacology? Psychedelics have been utilized for millennia for a variety of purposes and carry stigma as illicit substances in modern times. People often have a lot of beliefs and biases about psychedelics, and this can create some confusion. The American Journal of Psychiatry released a review in May 2023 providing some basic understanding of what a psychedelic compound entails, how we can think about the mechanisms of action, and how psychedelic compounds may shape the development of future novel therapeutics. First off, it's important that we share an understanding of what is meant by psychedelic. This paper defines a psychedelic compound as inducing an LSD-like state in humans and acts as an agonist at the 5-HT2A receptor. It's worth noting that dissociative anesthetics like ketamine or phencyclidine, as well as enactogens like MDMA, do not meet the definition of a psychedelic compound, even though they are psychoactive compounds. Even with this clear definition, psychedelics encompass a wide variety of substances, things like psilocybin, ibogaine, mescaline, and DMT, just to name a few. This paper cannot go into every compound and every potential therapeutic use for them, and indeed it really doesn't try to. The only conditions they explore in any detail are anxiety and depression, but we know there are lots of trials going on right now in trauma-related disorders, obsessive-compulsive disorder, and substance use disorder. This is an understandable but notable limitation. However, by grouping these compounds together and broadly describing the mechanisms they have in common, this paper does a nice job providing a framework for thinking about how these work. This paper zeroes in on the mechanism of action at the 5-HT2A receptor, which, as we know, is an important target in psychopharmacology. Our atypical antipsychotics block this receptor. Much research has demonstrated that when you block 5-HT2A receptors, it inhibits the psychedelic effects. This finding was demonstrated in both LSD and psilocybin. Psychedelic drugs binding to 5-HT2A receptors activate G proteins, resulting in changes to genetic transcription as a downstream effect. There's also evidence to suggest that psychedelics enhance neuroplasticity through the TRKB receptor, the receptor for brain-derived neurotrophic factor, or BDNF, and calorin-7 signaling. This could be one way that psychedelics act on depression. If we remember, enhancement of neuroplasticity through BDNF is one potential mechanism for the beneficial effects of ECT. Some research has questioned whether 5-HT2A is the primary therapeutic mechanism of psychedelics, but results have been mixed. Some trials with selective 5-HT2A antagonists like pimavanserin may be helpful in further exploring this question. The authors point out recent work with 5-HT2A agonist compounds used in mice, which demonstrate an antidepressant effect without the psychedelic effects. There aren't any human studies to review yet. Recent phase 2 placebo-controlled trials in humans of psilocybin and LSD combined with psychotherapy showed promising rapid reduction in symptoms of anxiety and depression. It can almost feel contradictory to see so many 5-HT2A agonists demonstrating improvement in depression, while existing drugs like mirtazapine and tricyclic antidepressants, as well as antipsychotics like brexpiprazole, are potent 5-HT2A antagonists. Chronic treatment with antidepressants has also been found to downregulate 5-HT2A receptors. I would have appreciated more discussion in this paper about reconciling the antidepressant effects of 5-HT2A agonists with our use of so many 5-HT2A antagonist therapies. The authors do spend some time on off-target effects of psychedelics, which can be problematic. Psychedelics activate a host of neurotransmitters and receptors, including dopamine, serotonin, and noradrenergic receptors. And of interest to us is the activation of D1 and D2 receptors. It's curious that while this paper references these receptors, it does not discuss any specific risks associated with patients who have a history of psychosis or those taking dopamine-blocking agents. They do bring up interesting and lesser-known concerns regarding psychedelic activation of 5-HT2B receptors which has been implicated in the development of valvular heart disease with other compounds like MDMA and ergot derivatives. No studies have directly explored these risks with psychedelics, but in theory, it would be important to consider with patients who are chronically microdosing psychedelic compounds. There is insufficient data to recommend microdosing, and there's enough concern about the safety to caution against microdosing. So what can we take away from this review? While we cannot generalize all the findings in this vast field of research, we can clearly identify that psychedelics are psychoactive compounds defined as inducing an LSD-like state and acting as an agonist at the 5-HT2A receptor. This action at 5-HT2A leads to a cascade of molecular effects, including the promotion of neuroplasticity via the TRKB receptor, the receptor for BDNF, and calorin-7 signaling. We are still in the early days of understanding the nuances of therapeutic mechanisms behind psychedelics and how these relate to psychiatric diagnoses and existing therapeutics. Psychedelics provide an exciting template for the development of future therapeutics, although at present there's insufficient data to support chronic use of psychedelics, such as through microdosing. There may also be potential valvular cardiac risks. In my own practice, I would more strongly caution my patients against attempting chronic microdosing, particularly if they have other existing cardiovascular risk factors. I'll also be on the lookout for future research on 5-HT2A agonist therapies, knowing that these may forge a path to safely harness the promising efficacy of psychedelic therapeutics.